Good evening, members, and welcome to our AAIP webinar using our video this evening. The video tonight is going to be on follow-up sequences using the awareness characteristics, which you had watched that video the last time. So if a patient comes in to see you, gets the plans, and they are presented with their options, but they do not want to make a decision right away, they want to go think about it, they want to get their money in order, whatever it is, and you can't close the sale that particular day, how do you follow up with these patients? How do you do successful follow-up steps using the awareness characteristics to get these patients back in again?
And so let's take a look at the video and then we'll comment on it afterwards.
Hi, I'm Dr. Lee Sheldon, founder of the American Association of Independent Periodontists.
And I'm Danielle Dorner, I'm co-founder, and we had put together these videos because we wanted to put together a visual for everybody to see exactly how we do each one of these modules. We've done webinars, we've done teleseminars, and this was our way to show you exactly how we do it. We found that we are actually going to use these for our own staff and training, and we hope that you guys can find this just as valuable.
So we hope you will enjoy these videos.
The goal in any sales cycle is to close the sale on that particular day, at that particular moment. But you know, that doesn't always happen. Just because it doesn't happen, that doesn't mean that the sale or the treatment acceptance is lost. There are real concerns that patients have. There are certain things they have to do. They might have to move money around. They might have to have other discussions. There are other things going on in their lives, and they have to put that in order to be able to accept treatment. Well, there's a certain number of steps, correct steps that we take in those scenarios in order to be able to make sure that the patient has every opportunity to get the treatment they need.
We all dream of the patient that's going to throw the credit card on the table and say, okay, schedule me, I'm ready to go. Of course we want that, but it doesn't always happen. And also, you don't want to be too pushy. If you get too pushy with these patients, especially the patients who come off the streets, it took them so long to call you, it took so much to come in and talk to you and tell you all this. The last thing you want to do is become pushy. So we have found that with the goal of scheduling and gaining acceptance the same day, of course, is first. But then you have to know when to just kind of go in their direction and let them understand that you do understand, and you're going to give them whatever it is they need to come back and accept.
But there are defined steps to take. In other words, we're always moving a patient forward. We want the patient to go from here to here, but there may be these steps that we need to take. And as long as we're building agreements with the patient, that in fact we can take these, let's say, sub-steps.
Yes.
As long as we come to those agreements together, then you're not being pushy, the patient has agreed to it, and we can take those sub-steps. So let's talk about some of the sub-steps that we take when a patient decides not to accept treatment.
Okay, there's a few different things here. One is we've already spoke about the awareness characteristics. And for awareness characteristics, as we said in that video, there's many of times that you're going to bring that out in a single appointment. You're going to bring it out on the phone when they call. You're going to bring it out with the assistant when you seat them initially. The doctor's going to bring it out. We're going to bring it out again in the financial room, because there's different areas for these patients that are dealing with these ruins. There's different stages that you're bringing them out of. One, you bring them out of them so they can actually schedule a new patient appointment. Two, you're getting it out of them so that you can find a story and tell Dr. Sheldon what's going on. And another time when you're bringing out the cost of treatment, well, they go back to ruin again and they decide that there's ways, oh, I just can't do this now, it's a lot of money. So the very first thing, if I can't get a patient to accept, it's going back to their ruin. So if I have a patient in the room and she says, oh, that's a lot of money, I think I'm going to have to, just kind of go home and think about this for a little bit, because, I just didn't think it was going to be this much money. Well, the first thing I'm going to do is I'm going to go back to the room and I'm going to say, Nancy, I understand that. I understand it's a lot of money. I understand that, you didn't think it was going to be this much money. But what I want you to understand is what brought you in here today. You came in here today because you've been wearing this slipper for 15 years. You've been single for 15 years and you want to take care of this. You want to get rid of it. You want to get this implant. It's going to cost $5,000. But there's ways that you can fit this in to your life. There's ways that you can, make this happen. I don't want you to focus on $5,000, because I want you to focus on what the $5,000 is going to do for you. It's going to get rid of your partial. It's going to give you this tooth. It's going to make you feel better about yourself. It's going to give you more confidence. It's going to change your life. And there's different things that we can do. You can do the care credit. The care credit's going to, either give you 12 months interest-free payments, or you can schedule payments over 60 months with very small payments. We can do a prepaid discount. There's things you can do. $5,000 is not really a problem here. So I don't want you to think so much about the money, but think about why you came in here today.
Yeah, and with that, now you're taking the money away, and now you're going back into why the patient came in. We all focus on money. I mean, any significant purchase that we make, all of us concentrate on money. We go back to that. Frankly, it's our escape clause. And our job as treatment presenters is to get away from that escape clause and get back to purpose. What's the purpose the patient came in for to begin with?
Remember, people buy on emotions, and some people are better than that than others. And I hate using the used cars salesman thing when it comes to this, but a long time ago, I was doing financial arrangements here, and I remember getting so upset because I worked so hard on trying to get someone to accept the treatment for periodontal disease. Yeah. And I didn't do a very good job. She didn't schedule. And a few months later, I saw her at Rooms to Go buying furniture, and I was so mad because she bought furniture. I was watching her buy a house full of furniture that cost more than her periodontal treatment. They did better than I did. It's about emotion. So whatever I was doing to try to get her to understand taking care of her periodontal disease, and she was a very young girl, they did a better job of making her home look better and selling her furniture. That's right. So it's all about the emotion. So there's a way of doing it, and going back to the ruin of how this is going to improve her life. The value she's going to get from this $5,000 investment, $25,000 investment, what is it going to do for her because they're back on the focus of money?
So let's talk about some of the agreements that you might come to in order to be able to bring a patient who says, I can't make that decision right now. Okay. What are the steps that you take? And by the way, what are some of the vehicles you use, whether it's phone call or text message or email, and give me a typical scenario.
Well, for a follow-up, if for example, we're working this first scenario of going back to the ruin, if she says to me, this is all just very overwhelming. I understand what it's going to be doing for me. I get it. And I really, really, really want this, but it's been a long day today. It's a lot, it's a lot that I've taken in. I just got to go home and I got to think about this. I'm not going to push her any further. I've already laid it all out for her, and I can't really do any more without becoming very, very tacky. So I'm going to say, I completely understand, Nancy. I completely understand. Go home and think about this. But here's all the paperwork. Here's everything. If you have any questions, please give me a call. I'll check on you in a few days just to make sure everything's okay. But definitely, take all this home with you. The very first thing I do that day is I write a letter to her, a personal handwritten letter on letterhead to say, it was so nice to meet you, Nancy. I look forward to working with you to achieve all your dental goals, to get you back out there again, to get you, feeling better about yourself again. I think that you're going to feel amazing once you're done with this. And I understand it's a lot to take in, but I'm here for you if you need me. Give me a call. Let me know if I can do anything for you. She's going to receive that in 2 to 3 days. In 2 days, I'm going to do a follow-up phone call for her. And I'm going to say, hey, Nancy, it's Danielle. I'm just calling to see how you're doing. I know, when you left, it was very overwhelming. There was a lot of stuff that we gave you. Is there any questions that you have after that? Is there anything I can help you with? Just try to talk with her. And I'm not going to say, are you ready to schedule? Are you ready to pay? I'm not going to go through that. I just really want to make sure that she's, ready to do this. And then at that particular phone call, I'm going to ask her, do you want to come back in and talk to Sheldon? Talk to Dr. Sheldon. Do you want to come back in and talk to me? Do you want to try to move her towards that direction? And for a lot of people, after I've called them, they're already saying, thank you so much for the letter. That was so nice of you to do that. I think that, okay, I am ready to do that. Or I have a few questions about that care credit. Or how much is that prepaid discount? And usually it's something that I can work towards and eventually get them to come back in again.
Sometimes it may be the husband or the spouse. Spouse, what's the spouse going to hear? Money. That's all the spouse is going to hear. And so there are times when you may need to, and we may want to encourage the spouse to come in. So the spouse is now involved in the entire decision. By the way, if that's not good enough, or let's assume you have a college student in your area and a patient needs a soft tissue graft, and mom and dad are 2,000 miles away. Online meeting. Using Join.me or GoToMeeting or something like that, where everybody can see the same thing on a computer screen, is very, very effective.
Yes. And another, just to kind of go over a few scenarios when we have a patient that's not accepting. Another one is they're not quite understanding what the treatment's going to be doing for them. And if I'm in the financial room and the patient says something like, I've never had anybody tell me that I need this, or I don't really understand why we have to do all of this. It just kind of seems like overkill, or I don't really think that I'm ready for all this. To me, that translates to the patient doesn't understand what the treatment's going to be doing for them. The patient doesn't understand the severity of the gum disease, whatever it is. So what I'm going to do at that point is I'm going to get Dr. Sheldon back into the room. I'm going to get you back into the room because I need him to reiterate the value of that treatment because they did not get it. So I'll go back to you and say, listen, they don't want to spend $3,000 on a cleaning is what they're saying. They don't understand it's root planing. They don't understand it's scaling of the roots. It's using the dental view camera. It's 7 to 9 millimeter pockets. They're not getting this. Yep. So I'm going to have you come back into the room.
Yep, and it's important because doctors, there's a certain cachet, there's a certain level of expertise that the patient is depending upon just by virtue of the fact that you're a doctor. And Danielle can probably explain the situation better than I can, but the fact that I'm there and I'm the doctor, and the doctor is being called back in the room, that's essentially is Danielle's signal to the patient that you really need to talk with the doctor again in order to be able to understand the severity of the problem. And doctors make time to do that. It doesn't take very long. You call me back in the room, what is it, 2 minutes,
Oh, it's
3
maybe
minutes?
2 minutes, yeah.
It's not much.
And they're always very appreciative of, thank you for coming back in here. Thank you for coming back and reiterating that to me. I didn't understand that. I didn't get that at first. Okay, I get it. I understand.
Yeah. So use that tool. And by the way, if the sales process is not going the way it's supposed to go, back up one step. So this is an example of backing up one step. I didn't do my job well enough, or at least the patient didn't receive what I thought the patient received. So now Danielle is having trouble in financial arrangements room. Back up one step, go back to the doctor. And there are other backup one steps that we can do as well. So that, for example, if we never found the patient's ruin using the awareness characteristics, well, back up one step. Go back and find out what's really bugging the patient, because obviously we didn't get there or the patient would have accepted treatment to begin with.
All right. And the other two things that I try to do when I'm doing these financials is I want to get the patient to commit to something, and maybe they're not ready to commit to payment, but I need them to commit with a step that walks them forward towards accepting treatment. So for example, if the complaint is, I need to go talk to my husband, I need to go look at my money, I need to go figure this out, my husband, my spouse, my significant other, my goal is going to be, well, I'm going to stop there, because doing financials, I know I'm not going to get any further. As soon as that spouse card comes out, it's done. So instead of pushing them and drilling the value, they get the value. They're just worried about what their husband's going to think when they bring home this bill. So what I'm going to do at that point is say, here's what I would do. I need you to go home, talk to your husband about this. I'm going to have both you guys come back on Thursday. Is 9 o'clock okay for you? That'd be a good time for you both to come in. You guys can talk to me, talk with Dr. Sheldon, and he can explain to your husband what's going on here, because it's really hard for you to go home and explain what pockets are and what this disease is and how it's going to get better and what it's going to do for you. So I don't even want you to go home and try to do that. I just want you to go home and say, Dr. Sheldon would like both of us to come back. He wants to explain to you what's going on here. And that way it takes it out, because I don't care how much they understood. They're not going to be able to go home and explain that value the way you and I did in that room. So I'm going to have them come back for that financial together. If it's not a spouse card, if it's something of, okay, well, I need to, get my monies together, and I need to, get my calendar, and I need to do all this stuff, I'm going to go towards scheduling the surgery. Usually if we schedule surgery, it's about 3 to 4 weeks out. I mean, we're pretty booked out in surgery. So what I'm going to say is, when I start hearing that kind of backup of, okay, I need to, get my stuff together. I really, really want to do this, but I need to get my monies together and do all this stuff. I can feel the brakes kind of coming on. So at that point, I'm going to make a suggestion. And my suggestion is moving them towards to accept. I'm going to say, okay, here's what I'm going to do. I'm going to go on ahead and get you scheduled for surgery, because we're scheduling far out. And I don't want you to put this off any more than you have, because I know you're really excited to get this done. So I'm going to schedule you for the surgery. The surgery is going to be in about 4 weeks. I'm going to schedule on a Monday. It's going to be at 7:30 in the morning. and then I'm going to schedule you for a pre-op 2 weeks before that, and you're going to come in. We're going to go over consents. We're going to go over the pre and post-op instructions. I'm going to give you all your supplements, all your goodies that involved in taking care of yourself before and after the treatment, and that way we can get all this on your calendar and get all this rolling. If these dates are not good, you give me a call back, that's fine, but let's go on and get this rolling because we've been putting this off long enough. And I'm going to schedule them for surgery, schedule them for the pre-op, and that way I'm moving them towards acceptance.
So it is an agreement. It's a sub-agreement. They're getting back together. They've scheduled a date. Even though maybe I'm not quite right, they've scheduled a date. So we're going to the next sub-step.
Yes.
Important that we create all of these agreements and do sub-agreements. Find something that you can agree to, and you'll be surprised how many more patients are going to be able to accept treatment because we're willing to accept their personal situations and make them our own, and eventually they're going to make treatment their own as well.
We hope you have enjoyed this video. If you have any questions in regards to it, please email us.
The American Association of Independent Periodontists is there to help every periodontal practice do better. I'm Dr. Lee Sheldon.
And I'm Danielle Joyner. We'll see you on the next video.
All right, now, just so that you all know, the bonus webinar we are doing at 9 will go over a lot of the tools that you and your staff can create that you can send the patient home with when you can't gain acceptance. So we're going to go over building those tools, creating those tools, and getting those in the hands of your staff and your patients so that you have that. So if you want to learn more about those tools, please attend that webinar tonight.
Yeah, this is essentially for the patient who says, well, I want a second opinion.
Right.
Or let me go home and think about it. Or is doing some reading and more research and that type of thing where you say, oh, gee, that patient probably will never come back. Well, this will make that patient come back.
Yeah, and so they know what they're getting at your office versus what they're going to get at another office that may give them a cheaper price. So very, very important tools there.
So email us at aipsheldon@gmail.com if you don't have the link and if you haven't signed up. We've got quite a few
Right.
people signed up.
Right. So to just reiterate the steps there, again, going over the webinar, the video that we did last month, very important to find the patient's ruin. Don't always assume it's money. Don't always assume, it's something that they haven't told you what it is. Find that ruin. So it's finding out the why, getting personal, building that relationship with the patient of what brings you in today, why now, how is the situation affecting you, and elaborate on that. And that's the emotional button you're finding. Okay, they're coming in today because of a loose tooth. Well, what is that loose tooth doing? Is it causing them daily fear? Is it causing them to not eat their healthy foods? Is it causing them to not work, to not have a relationship? Whatever it is, find that because you're going to use it during the financial portion of their visit. Also, when you're in that financial with that patient, also remember, as we said in the past video, is to be sure that you use your tools. Not only the tools we're going to talk about at 9 o'clock, which is paper creating document tools, but also models, photos, x-rays, to give them visuals to explain. We talked before many times about the SNAP program. That's to do the before and after workup, so the patients can see what their smile could look like. If you cannot get them to schedule, as we said, try to get them to come back for a second financial appointment with you. Offer the doctor again if they want to talk to the doctor again, and bring a spouse. If the problem is they have to talk with their significant other, their mom, their dad, their husband, their wife, have them come back for a financial and just say, I'm going to have you guys come in tomorrow. I'm going to schedule you guys to come in to see me tomorrow or Thursday, soon, not weeks, soon, days, the next day, 2 days, and that way they can come back and you guys can go over all this together. And I say, instead of you trying to go home and explain what we have just tried to, to get you to understand in an hour and a half, let us do it. Like Dr. Sheldon said, we can do the join.me. We can do it online. So try to get them to come back for a second financial appointment or schedule the surgery. proceed. They're excited. They say they want to do it. They got to get monies in order. Schedule the surgery. We're scheduling way out. I'm going to get you on the schedule so we can go on ahead and get this on the books, on your calendar, and we can start planning for this. And we're also going to schedule the pre-op, which AKA also is the financial. Yes, you're going to be going over pre-op, but you're also going to collect, go over the consents, sign the financial. So go forward with that. Yes.
Just want to make sure that people know that everybody pays us in advance, correct?
Yeah.
Before they come into the surgery.
We do not accept insurance. We're not an insurance office. We are pay for service. We do have all patients pay in full 2 weeks before their surgery. Our goal always is to collect during the financial, which is when they come in. So that's their initial goal. And then we work at the latest 2 weeks before surgery. So yes, and we have done that very successfully. So you do want to send them, if they are talking about this is a lot of money, I'm not sure if I can do this, I'm not sure if I want to do this, it's more money than I thought. If money is the factor and they're waving that second opinion flag in the air, that's where you want to make sure that you are educating them and you are sending them away with valuable tools that they know to compare apples to apples, because the other offices are not like your offices, but they do not know that unless you educate them and you tell them. So as I said, at 9 o'clock, we're going to go over things that you can build to do that. How do they know? What do you do that they don't do? What is the difference? So it's informing them of that, because we have sent away many of patients with that paper that have come back and said, yes, you are not the cheapest, but no, I'm not going anywhere else. So very, very, very important. And then also the letters, the calls, very important touches to be sure that if they are not accepting, and even if you have them scheduled in 2 days, even if you have an agreement for a surgical date, send the letter, make the phone call, ask them how they're doing. Did you have any questions that you thought of after you left? Any concerns, anything else I can help you with? And then mention something personal from the appointment, good luck at your reunion, or, whatever it is, just to do that personal touch that way. Very important ways to get that patient to come back again. That's what I have.
So when you build a good recipe, a good recipe might have a lot of different ingredients in order to be able to create some depth of flavor. Yeah, we could all take a hamburger and put it on a grill, and we end up with a hamburger. But what happens if you season the hamburger correctly? What happens if you use the best bread? What happens if you have all the best condiments? What happens if you accompany it with some great salad and or coleslaw, or anything that would enhance that? What would happen if you took that hamburger and made a beautiful stew out of it, and you used a lot of different ingredients with a lot of fruits, with a lot of vegetables and potatoes and things like that to really make it good? Every little component that Danielle's talking about now is the recipe to not only get a better acceptance rate, but also to get an acceptance rate of a larger type of treatment plan. And we're not talking about treatment plans that aren't necessary. We're talking about treatment plans that are necessary, and a person might be scratching his head and say, I can't afford that, but it may be that we're not putting in enough ingredients for the person to be able to say that he or she can afford it. It's routine that we'll have $50,000 cases, or $25,000 cases, $60,000 cases. This becomes the routine in the office when you add all of these ingredients together. So it's important to just say, well, rather than just say, well, I can only do that. Yes, absolutely. Put in that one ingredient now. But listen to this, or watch this DVD again and again and again. Watch this webinar again and again and again, and now find out what's the next ingredient you can put in. And keep on adding those ingredients until you say, all right, I've really got the recipe now. And you'll see that as a result of that recipe, there'll be much greater acceptance, both in terms of acceptance rate and in terms of the amount of treatment that a patient is willing to do. So that.
Yep, that's it.
All right, that's it for this webinar. We'll be back with you at 9 p.m. Eastern. For those who need the link, aaipsheldon@gmail.com. Send us an email right now, and we'll get you a link to the 9 p.m. webinar.
Have a good night.
Good night.